Our hospital-wide goal is to get you up and out of bed within 1 to 4 hours after your surgery. Physical therapy or nursing staff will get you mobilizing and out of bed as soon as possible. Walking and doing your home exercises is really important after your surgery. Feel free to call your nursing staff if you are ready to get out of bed and go for a walk. We always want you to call first and never get up by yourself until you're cleared to do so by the physical therapist. You are in an unfamiliar setting, just had surgery, and have had different medications and pain blocks. We always want to make sure that you are safe and successful. This is also why we will encourage you to use a walker after surgery. Physical therapy will teach you what you need to know in order to be successful at home. In your knee and hip replacement guidebook, you can find exercises that your physical therapist will teach you in the hospital on pages 28 to 31 if you would like to look at them ahead of time. It is your responsibility to set up an outpatient physical therapy appointment for after your surgery. Select where you would like to go for physical therapy, make sure they're a preferred provider for your insurance, and set up your appointments. If they ask you for a referral from your surgeon, please call your surgeon's office and request that they send your physical therapy referral to your facility of choice. We have included a link below titled Physical Therapy Resources that has a list of physical therapy offices in the surrounding areas and their contact information for you to use if needed. For total knee replacement patients, it is extremely important to set up your physical therapy appointments to start 3 to 5 days after your surgery. Scar tissue can build up behind your knee if you're not doing the proper exercises after your surgery, and for this reason, it is very important to follow the guidance of your physical therapist and do your recommended range of motion and walking exercises. For total hip replacement patients, it is usually recommended to have your first physical therapy appointment 7 to 10 days after your surgery. Hips do not develop scar tissue like knees do. Therefore, for hip replacement patients, walking frequently is the most important therapy. For both knee and hip patients, you can expect to go to outpatient physical therapy 2 to 3 times a week for 6 to 8 weeks, depending on the recommendation of your surgeon and your physical therapist based on your progress. At home, in addition to completing the exercises shown to you by your physical therapist, we want to make sure you're up and walking about 5 minutes every hour while you're awake for the first couple of weeks, and then gradually increasing the time and distance you walk per your tolerance and physical therapist recommendations. Not only does walking help build strength and endurance, but it helps wake up all the systems in your body and prevents complications such as blood clots, pneumonia, and constipation.